CNA Resident Clothing Choice Autonomy. Welcome to the quiz. Question 1. A resident is in the active phase of dying and has Cheyne-Stokes respirations, cycles of deep breathing, then shallow, then pauses. The family at the bedside is very distressed by the pattern. What can you say to provide comfort and explanation? Option A. I know this breathing sounds scary, but it's a common pattern at this time. It's called Cheyne-Stokes breathing. The breathing goes in cycles, and the pauses can be long. It's a sign the body is slowing down, and it's not painful or uncomfortable for him. Let's just be here with him. Option B. Try to tap him on the shoulder gently when he stops breathing to remind him to breathe. Option C. This breathing pattern means the end is very near, probably within hours. While true, this can be too blunt without a comforting context. Option D. I'll go get the nurse to give him something to stop this irregular breathing and make it normal. The answer is A. Explaining the phenomenon and reassuring that it's not painful comforts the family. Option A is correct because it explains the phenomenon, reassures that it's not painful, and offers comfort. Option B is incorrect because tapping is not appropriate. Option C is blunt without reassurance. Option D is incorrect because you can't stop it. Question 2. You're about to enter a resident's room to provide care. You knock on the door and hear a faint, "Come in." Upon entering, you find the resident and their spouse in an intimate embrace. What should you do? Option A. Apologize quietly, say, "I'm so sorry, I'll come back later," and leave the room immediately, closing the door behind you to give them privacy. Option B. Tell them this behavior is not appropriate in a nursing home and they should wait until visiting hours are over. Option C. Proceed with your task as quickly as possible, ignoring the situation to show it's normal. Option D. Stand in the doorway and ask when a better time to return would be. The answer is A. Respecting privacy and intimacy is essential. Option A is correct because it respects their privacy and intimacy. Option B is incorrect because it's judgmental. Option C is incorrect because it invades privacy. Option D is incorrect because lingering is intrusive. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 3. A family member of a resident confides in you that they are feeling extremely guilty about placing their loved one in the nursing home. What is your most appropriate response as a CNA? Option A. Listen empathetically without judgment and say, "This is such a big adjustment for families. It sounds like you're feeling very torn and guilty. Those are very normal feelings. Would you like me to let the social worker know you might want to talk to someone about how you're feeling?" Option B. Reassure them that their loved one is in good hands and they have nothing to feel guilty about, as this will make them feel better. Option C. Tell them that you're not qualified to discuss feelings and they should speak to the social worker, then change the subject and walk away. Option D. Agree with them that it's a difficult situation and suggest they visit less often to ease their guilt. The answer is A. Empathy and appropriate referral are helpful. Option A is correct because it offers empathy and an appropriate referral. Option B is incorrect because false reassurance minimizes. Option C is incorrect because abrupt referral dismisses feelings. Option D is incorrect because suggesting less visits is not helpful. Question 4. You are assisting a resident with ambulation who suddenly becomes weak and begins to fall. What is the most appropriate action to ensure both your safety and the resident's safety? Option A. Quickly move behind the resident, grasp the gait belt securely, and gently lower them to the floor, bending your knees and keeping your back straight to protect your own back and control the fall. Option B. Step back and allow the resident to fall to avoid injury to yourself, then call for assistance to help them up. Option C. Attempt to stop the fall by grabbing the resident's arm and pulling them back upright, using your body as a strong support. Option D. Shout for help immediately while trying to hold the resident up, hoping another staff member arrives before you both fall. The answer is A. Controlling the fall protects both the resident and yourself. Option A is correct because it controls the fall, protecting both. Option B is incorrect because allowing a fall is unsafe. Option C is incorrect because grabbing an arm can cause injury. Option D is incorrect because hoping for help is not reliable. Question 5. While providing perineal care to an incontinent female resident, you notice a raised area with a small amount of white discharge in the labial folds. What is your priority action? Option A. Gently clean the area from front to back using a soft cloth and peri-wash. Dry it thoroughly and report your observation of the redness and discharge to the nurse immediately after finishing care, as this could indicate a yeast infection needing assessment. Option B. Document the finding in the resident's chart and continue with your duties, as this is a common finding. Option C. Ignore it, as discharge is a normal finding in incontinent women, and continue with the care. Option D. Clean the area thoroughly with antiseptic wipes and apply a thick layer of barrier cream to treat the possible infection. The answer is A. Proper cleaning and reporting are essential. Option A is correct because proper cleaning and reporting are essential. Option B is incorrect because documenting alone is not enough. Option C is incorrect because ignoring could miss infection. Option D is incorrect because antiseptics and barrier cream may not be appropriate. Question 6. A resident with a history of dysphagia begins to cough and has wet-sounding respirations while eating lunch. What is the most immediate and crucial first step? Option A. Instruct the resident to stop eating immediately and lean forward slightly to encourage effective coughing and clear their airway. Stay with them and observe closely. If the cough doesn't clear, call for help. Option B. Encourage the resident to take a sip of water to help wash down the food that is causing the cough. Option C. Leave the resident to go get the suction machine set up at the bedside. Option D. Slap the resident firmly on the back to dislodge the potential obstruction. The answer is A. Encouraging natural clearing and monitoring is the first step. Option A is correct because it allows natural clearing and monitoring. Option B is incorrect because water can cause aspiration. Option C is incorrect because leaving is unsafe. Option D is incorrect because back slaps are for complete obstruction. Great job! Don't forget to subscribe. Bye!